Well, that's great. I just want to say we're so grateful for Apotex that supplies vast majority of drugs right across the country and in here in Ontario, and we want to make sure we protect them because they're the ones delivering medication to all of us. I want to thank Apotex and Jeff Watson and his whole team for putting this together, along with Barb Collins and Humber. I'll tell you, folks, Humber is one of the greatest hospitals anywhere we have in the country, and I want to thank the Solicitor General Sylvia Jones for her strong leadership in making sure we get into high priority neighborhoods, along with high priority facilities like Apotex, along with other manufacturing sectors, meat, poultry, pork manufacturers. We're really, everyone's just doing an incredible job right now. We've turned it up over 100,000 vaccines over the last few days, and we're just going to continue building on that. So folks, our goal, 40% of the population in 28 days, and we can't do it without all these folks here, so we're very, very grateful.
Vaccines, are there enough vaccines to do that many people last weekend?
Well, right now, excluding pharmacies, excluding primary care, and anyone who's not on the provincial site, we have booked 1.9 million vaccines. So to answer your question, we're short about 500,000 or more vaccines, but I'm confident with the conversations with the federal government. They're really trying hard. They're trying to get as many vaccines as possible, and I'm confident they're going to do it. I understand J&J is going to be coming out in the end of April. We don't know how much, but that's positive news as well. And again, as I said on my press conference the other day, folks, let's stay positive. We need to stay positive. We're going to get through it. I understand everyone gets frustrated throughout this pandemic, but we're well ahead of a lot of places around the world because of the people here in Ontario. We have the greatest doctors, greatest healthcare workers, greatest pharmaceutical companies right here, and we're going to get through it, and we're going to see light at the end of the tunnel here.
The hospitals, elective surgery. What do you have to say to people that are now no longer going to be able to get their cancer surgery or their heart surgery or knee replacements?
Yeah, we're in that situation as we were at the beginning of the pandemic, but the quicker we get these vaccines into people's arms, we'll be able to lighten the load on ICUs. So our two-pronged plan is to limit mobility, and that's the reason we have a stay-at-home order until we can lower the ICU. And part two to the plan is what I was saying earlier, going into the hot areas throughout the province and vaccinating where we see 60% of the cases in Toronto, Peel, and York. We have some issues in those areas with the pandemic and the virus really growing, so we're going to put those fires out. But we're working right across the province. Everyone's getting per capita allocation, but the hot areas need a little more to put out the fire, as we say. But you know something, folks? Again, you have to go on the news. You look around the world. Ontario's doing pretty well right now.
But the people are still not going to get very important surgeries.
And I understand that. It's quicker we can get these vaccines into people's arms, the quicker they're going to be able to resume the surgeries. And we have to have the capacity, the ICU units. We are moving and creating more ICU units. Total number of beds we've created is over 3,100 beds in our system, and we're working on it. And again, I'm going to call out Barb Collins, CEO of Humber, and all the other CEOs that are just fabulous, and we're so fortunate to have them. But folks, we will get to those surgeries as soon as possible.
You had yours vaccine, of course, in the timely manner.
Yes.
And how do you feel now?
I feel fine. I really encourage people not to be hesitant. I know there's some hesitancy out there. It's so important to go get a vaccine, and all of them work. No matter if it's AstraZeneca or Moderna or Pfizer, if you have an opportunity to get a vaccine, please get it, because every doctor I talk to, it's going to do two things for you. It's going to save your life, and it's going to keep you out of the hospitals and keep you out of ICU. So I encourage everyone, please get out there. And a quick shout out to the great frontline healthcare workers. I know there's a little bit of hesitancy with the frontline healthcare workers, excluding the docs. Please get your vaccine, and we're doing everything we can to get your second doses out there as well. We're really working on that, because I know without the frontline healthcare workers, we'd be in trouble, and I really appreciate all the work they're doing.
Thank you, Mr. Mayor.
Thank you.